Hi, today we're talking about human papilloma virus, also known as HPV, and its relation to cervical cancer. HPV is the most common sexually transmitted disease. It has at least 14 types that are cancer causing, and the rest are non causing. A small proportion of infections with certain types of HPV can progress to cervical cancer. Non-cancer causing types of HPV can cause genital warts and respiratory papillomatosis. Not showing signs of having HPV doesn't mean that you don't have the virus, because it could have no signs while still being passed. HPV can spread through all types of sexual contact with an infected person, including vaginal, anal, or oral sex, as well as close kinship. It also doesn't show immediate signs. The symptoms can be developed years after having contact with an infected person. Some of the HPV complications is that it causes cervical cancer and oropharyngeal cancer, and it often takes years to develop after getting infected. The genital warts and cancer are both resulted from different types of HPV, which means that the emergence of warts doesn't mean necessarily that you will develop cervical cancer. Unfortunately, people with weak immune systems can't fight the HPV virus as efficiently as someone with a good immune system.
Now, to avoid HPV, you have to be vaccinated, and we will talk about HPV vaccination in the next slide. And to make sure that you're having safe sex, and it's to use devices such as condoms to reduce the risk of transmitting sexually transmitted infections, and to be in a mutually monogamous relationship. And it's when two partners agree to be sexually active with only one another, and that kind of relationships reduce the risk of acquiring sexually transmitted infections. And screening for cervical cancer, this method is to avoid cervical cancer, and we will talk about it later in the slides. HPV vaccination is the first step to prevent HPV transmission, and that's done by vaccinating the girls aged between 9 and 14 years before they become sexually active. There are 3 approved vaccines, all protecting against both HPV type 16 and HPV type 18. Those are the types that cause cervical cancer, and the third vaccine protects against 5 additional oncogenic HPV types. The HPV vaccines work best if administered prior to exposure to HPV. Vaccines are to prevent the infection, so they don't treat HPV or HPV-associated diseases. And even if you are vaccinated, screening for cervical cancer should be done regularly. There is no test for HPV, so most people with HPV don't know that they are infected because they don't develop symptoms. They find out they have HPV when they get HPV-associated disease, or when women get an abnormal pap test result during cervical cancer screening. It also does not have a treatment, but health problems caused by HPV have, such as genital warts, cervical precancer, and other HPV-related cancers.
One of the main complications of HPV is cervical cancer, which is the fourth most frequent cancer in women. As we mentioned before, cervical cancer is developed from the HPV infections, some types of HPV infections. It's also known that women living with HPV are more likely to get cervical cancer compared to women without HPV. That's why all women should get a test annually to detect the cell changes before the before the normal cells changes to cancerous cells. As we know, there is a high risk that HPV develops to cervical cancer, but there is one point that we need to know that not all HPV types develops to cervical cancer. Some of the HPV infections clear up on their own and resolve spontaneously without developing to cervical cancer. Um, we also have to know that cervical cancer can be developed faster in women with a weak immune system. not as the fully immune system women. That's why the WHO in 2020 recommended three stages of preventions to control the cervical cancer. The primary, secondary, and tertiary prevention. The primary prevention includes the vaccination for girls aged from 9 to 14. The secondary prevention, which is testing or screening women above the age of 30. The tertiary prevention includes the treatment of invasive cancer.
And I will talk about the risk factors for HPV persistence and the development of cervical cancer. The HPV type, its oncogenicity or cancer-causing strength. The immune system, which people who are immunocompromised, such as those living with HIV, are more likely to have persistent HPV infection and a more rapid progress into pre-cancer and cancer. Co-infection with other sexually transmitted agents, such as those that cause herpes simplex, chlamydia, and gonorrhea. Parity, number of babies born, and young age at first birth, and people who smoke tobacco. Now we have symptoms of early stages and advanced stages of cervical cancer. For the early stages, irregular blood spotting or light bleeding between periods in women of reproductive age. Post postmenopausal spotting or bleeding, and bleeding after sexual intercourse, and increased vaginal discharge, and sometimes foul smelling. Symptoms of advanced stages: persistent back, leg, or pelvic pain, maybe weight loss, fatigue, and loss of appetite, some foul smell discharge, and vaginal discomfort, swelling of a leg or both lower extremities.
Now we will talk about screening and treatment of precancer lesions. Cervical cancer screening involves testing for precancer and cancer. More and more testing for HPV infection is performed. Testing is done among women who have no symptoms and may feel perfectly healthy. When screening detects an HPV infection or precancerous lesions, these can easily be treated and cancer can be avoided. Screening can also detect cancer at an early stage, and treatment has a high potential for cure. Because precancerous lesions take many years to develop, screening is recommended for every woman from age 30 and regularly afterwards. For women living with HIV who are sexually active, screening should be done earlier as soon as they know their HIV status. Screening has to be linked to treatment and management of positive screening tests. Diagnosis of cervical cancer must be made by histopathologic examination. Staging is done based on tumor size and spread of the disease within the pelvis and the distant organs. Treatment depends on the stage of the disease, and options include surgery, radiotherapy, and chemotherapy. Palliative care is also an essential element of cancer management to relieve unnecessary pain and suffering due to disease. There are three types of screening tests: HPV DNA testing for high-risk HPV types, visual inspection with acetic acid VIA, conventional PAP test, and liquid-based cytology LBC. For treatment of precancer lesions, WHO recommends the use of cryotherapy or thermal ablation and loop electrosurgical excision procedure when available. For advanced lesions, women should be referred for further investigations and adequate management.